Well, with me now is Rachel Carrell, who's the CEO of Lloydspharmacy Online Doctor. Hello to you. Thanks very much indeed for coming in. What do you make of this provider deciding it's going to pull out now?
Well, the whole thing at NHS 111 has been a disaster. It's been a crawling disaster, and I think it's hit a real major bump in the road. I think it's an example of the kind of thing that the NHS needs more of in a way. It needs to think more creatively about how it uses technology. It needs to think about remote healthcare. It needs to increase access. But the way that it was done, with rushed implementation to a political deadline, hardly any training, insufficient funding, it really has been a complete disaster.
I mean, we were told that it would be a better system than previously. You can, for instance, book an ambulance. You can book out-of-hours GP appointments. These are things that are very valuable to people, very important to people, and it wasn't a service that was provided before.
No, well, there's certainly some ways in which it is an improvement, and as we saw just now on the programme, where it works, it is working well, and it's worked in some parts of the country. The problem, though, is that it's not working everywhere, and that really is just a symptom of it not having great leadership from the start, and of it being rushed. They didn't do pilots, which they should have, and they should have done a lot more testing. That would have brought out to light some of the problems that we're seeing now, and they could have been fixed in time. Unfortunately, that just never happened.
So you're saying that all this is the result of political considerations, trying to just bash this out quickly?
Yeah, that's exactly right. The other thing that's been happening in the background is the NHS has been distracted for about the last 2 years by a major reorganisation. So not enough attention was paid to this kind of thing. The thing that I think is most important is that we don't throw the baby out with the bathwater. Remote healthcare is the way of the future. It is really important. We do need to make telephone consultations part of this.
OK, so how do we fix this problem then? How does the government, the NHS, sort out this helpline so that it is fit for purpose?
Well, it's a really tough job now because it has been deployed with so many problems. It's facing a real crisis of public confidence in the service. It definitely needs strong attention. It needs a review. It needs clinical leadership urgently. In some places it is working well, so they should concentrate on the places where it isn't. And they need to really urgently ask who is going to take this over. And that will be different in each local place. In some places it'll be ambulance services, in some places it might be out of hours, in some places there'll be other solutions.
OK. Rachel Carrell from Lloydspharmacy Online Doctor. Thanks very much for coming in. Thank you.